Let's get a reaction to those comments by the Prime Minister. The statement has been described as a slap in the face by some medics and campaigners. Well, I'm joined now by Mark Adams, the Chief Executive of Community Integrated Care, one of the UK's largest health and social care charities. Very good evening to you, Mr. Adams. Well, straight off then, your reactions to what you heard from the Prime Minister yesterday.
I think the whole of the social care sector just took a massive deep breath of disbelief, having fought for 3 or 4 months to desperately try and keep people safe, people taking huge personal risks and sacrifices. To have the most senior politician in the country say what he did was devastating.
Well, there was some, what they say in political parlance, clarification about what the Prime Minister really meant today. Did you follow that? Do you accept it?
Absolutely not. So I think that if you just look at the two statements, it's a bit like saying, pink and green and white and blue. I mean, they absolutely have no correlation whatsoever. I think it was just a political cover-up.
Well, let's examine the statement in more detail from its first iteration. I mean, is any of it true? Did some care home bosses and staff not follow procedures?
No, I mean, since the crisis began, the normal procedures that the whole care sector follows, where we've got regulation from the CQC in England and the care inspectorate in Scotland, everybody was just looking for new guidance in terms of how do you deal with a pandemic. It's not the sort of thing you face every day. The Public Health England, who give the guidance, have sent out over 100 variations of their guidance, which started off with, it's okay to take transfers from a few hospitals, it's okay to not wear PPE in a care home, you don't need to wear a mask outside in the street, it has no benefit whatsoever, etc., etc. And gradually it's tightened up and tightened up. But of course, when you've got, in our case, 6,000 frontline care workers, and you're literally almost weekly telling them to ignore what you said last week and start doing something different, it really is very difficult to manage.
In actual fact, well, given some of that early advice, and I remember reporting on it, which turns out to have been fundamentally wrong, following through from what the Prime Minister said, if care homes had not followed those procedures, such as not testing discharged patients coming in from hospitals and make sure that they'd had proper PPE, the outcomes might have been better.
Well, if you take the case of our own charity, I mean, we felt really quite challenged in saying that we weren't going to take any hospital transfers. We had people saying we were letting down the system, we weren't doing our part, but it just seemed that if you weren't testing somebody and you weren't sure that they were clear of COVID, why would you move them into the most vulnerable part of society? And yet the government allowed 25,000 transfers to take place. So it's no wonder that we've had the problems we've had.
And do you feel at the NHS that hospitals were prioritised over care homes? There was this rush, wasn't there, to make sure there would be enough beds in hospitals to deal with the flood of COVID-19 patients?
Yeah, I think the government got it wrong. They were slow out of the traps. They were still going to Cheltenham and welcoming Spanish football fans over in mid-March. And most of the care sector by then had gone into lockdown anyway, ignoring the government lack of guidance. You've got a situation where we literally have been on our own throughout this, having to make our best judgments. And I think that really what the sector was looking for was the government to acknowledge they'd made mistakes and really try and get their act together ahead of a potential wave 2 in the autumn. So to suddenly find the Prime Minister's trying to pass their failings onto the sector, it's just so desperately disappointing.
And it's important now, isn't it, for the future? I mean, before this crisis came along, so many problems in the care home sector in terms of resourcing and all the rest of it. It's important, isn't it, that from this, the care home sector stays front and centre.
Well, I mean, everybody knows that the NHS is a wonderful organisation with 1.2 million fantastic workers, but the social care sector with 1.6 million deserves every bit as much credit and recognition. And I think, to be honest with you, it's proven itself throughout this crisis. But we've still not got support on PPE. The testing only this week has got up to a commitment to do weekly testing, and that is as a minimum what we need. The funding that was promised months ago, only about 25% of it's actually getting through to frontline operators. there's a danger of real system failure with charities and other organisations failing unless the government not only stands up to this crisis and makes sure that social care is protected, but then delivers the long-awaited reform where social care frontline workers really get the recognition and the remuneration for the job they do.
Indeed. Mr. Adams, thank you very much indeed. Mark Adams there, Chief Executive of Community Integrated Care.